First one I'm going to ask here, can ozone injection help reduce chronic scar tissue?
Yes. Yes, I was going to say that the prolozone treatment that is done by Frank Schallenberger, he teaches a whole prolozone scar treatment, and it basically is giving prolozone with a little bit of cortisone and going underneath the scar itself and injecting the prolotherapy and then injecting your ozone and lifting up that scar. And part of it, I think, is that because ozone is supporting the fascia, and we're all talking about this fascial planes, when we can lift that up and give some space with the fluid that's in the prolo and then lift it up even more and oxygenate it with ozone, I think that's why it's so successful in treating scar therapy.
Great. Next question. We got to move on quickly. Sorry, I know there's going to be for small animals. How much do you put in each acupuncture point for ozone?
For small animals, how much ozone you put at the acupoint? It depends on the acupoints, but on the back shoe points, you can put 3 to 5 milliliters in a dog. On the points that are on the limbs, 1 milliliters, 2, something like that.
I agree with that, and I usually do a concentration of about 35 micrograms. If you're going to use more, decrease the concentration.
Okay. Another question. What about treating melanomas on horses? Can somebody address that?
There we go. Yeah, absolutely. I think it's really most remarkable. I don't think you need to even worry with injecting the melanoma themselves, although if you want to inject intralesional ozone, that's fine. They do tend to rot and be very, very messy and attract flies, but if you had appropriate maggots, they actually quite useful for cleaning out very large melanomas under the tail and something like that. You can actually use medical maggots if you want to reduce bulk with them. Ozone, however, does kill medical maggots, so you've got to be careful with that if you're using it to treat a tumor. You can use ozone intravenously, and that's mostly what I do is direct IV with the ozone, and that just gives great blood supply to bring. And what it also does, it helps to allow the white cells to get out of the capillaries and the arterioles into the tissue to start creating abscesses to wall them off, to block off the ozone, and then they will die without good. Everybody says, well, you're creating good blood supply. Yes, but good blood supply will actually create a much more effective exteriorization of inappropriate tissue and infection. So when people say, oh, don't acupuncture around tumors, I've done that all the time. Guess what? You get the blood there, and it doesn't teach them to grow. It teaches the cells to say, I don't like you, and to push the tumors out. So again, I think that this is important. We're trying to create normal function. And if we have normal function, we're not going to be helping tumors.
I'll add a comment to that, in that a lot of these cancers are considered rogue cells. They've been cut off from communication so that they don't get the signals to go and have cell death. And when we use products that enable that communication to be rebuilt, because we know glyphosate breaks it down. It breaks down actin filaments, and it breaks down the communication between the microbiome and the mitochondria. When we can rebuild that in ozone and things like Restore or Ion Gut, help to put those back together again, now the body starts using its own innate intelligence, and it sees what it needs to do, and it goes into action.
Awesome.
For melanoma, we don't have any kind of treatment at all. No conventional treatment. Sometimes little surgery, but with ozone, sometimes we can have 10% of success. We have some cases where we have some success. It's difficult to repeat this success, but it's something that you must try because you don't have anything more to do. And sometimes we can really decrease the tumor and control it for a long time. We inject inside the tumor, as Dr. Judith said.
Good.
Ozone breaks down biofilm too, and one of the other things that happens with tumors and with infections, biofilms form, and the body can't find the cells that it needs to attack. It also, with cancer, you have things that are called enslaved monocytes, which actually end up showing up to protect the tumors. Well, that is really bad signaling, and ozone and heat shock protein 70 and things like that can tell those monocytes to stop doing that and start doing their job of attacking the tumors.
All right, let's move on. Thank you guys for that interaction and responses. If you have a full, this is Romina, if you have a full with high lactate levels and SIRS, S-I-R-S, do you recommend ozone therapy, and how do you manage it? Anyone want to spring at that?
I would give anybody with immune-mediated disease or immune-suppressive disease, I would give ozone. I've given ozone to foals that had rhodococcus pneumonia and were completely immunosuppressed with that, and it was the only thing that kept those little guys going. And they don't respond well. You don't want to be giving those little children, a pile of steroids to stop, rhodococcus pneumonia inflammation. You want to be able to help those kids handle it on their own, and they do a whole lot better with ozone than they do with with conventional treatments.
Another area that we're not talking a lot about, but we need to, is when the body is in a sympathetic state, all of its repair mechanisms and detoxification mechanisms are turned off. So it's a huge need to make sure that we're putting these animals into a parasympathetic state. We do it with a variety of devices, and I find that ozone actually facilitates that as well. But when we can put them into a parasympathetic state, we're turning on all the rest, repair, and digest and detoxification systems, which allows. There is new studies now that show that when you stimulate the ventral root of the vagus nerve, it puts them into a cell danger response mode, and the mitochondria basically go into a bunker, and then they don't respond to anything, even the good stuff. So again, it's really important to put these animals in a parasympathetic tone, be able to stimulate the dorsal nerve root of the vagus nerve, which whatever means you're using, so that those mechanisms can get turned back on again. You start making energy from the mitochondria, and the rest, repair, digest systems kick back on.
And that is established so specifically by facilitating microcirculation. When we are in sympathetic, we have microcirculation on the periphery and the skin. It shuts down, and it shuts down to shunt blood to the critical organs. And so this is the biggest problem. And one of the things that we really know about ozone is that it's going to facilitate nitric oxide, which vasodilates, which helps the microcirculation work. We also we turn on the signaling again to allow the microcirculation to actually pump. Microcirculation needs to have blood supply itself. It is a blood supply, but it needs to have blood supply. And so we want to have, this work through other mechanical means. There are the devices that can help it, and that's why I use Beamer and ozone together, is to facilitate the microcirculation. There isn't anything wrong with any of us that's going to be made worse by more oxygen in and more toxins out.
And for that reason, this is really an important component for understanding this pneumonia that is happening with the COVID, because to get that microcirculation to occur in that lung, they don't have anything conventionally that can do that. They're trying to create a drug or a vaccine or something, but meanwhile, in the next few months, hundreds of people are going to be dying, thousands of people, maybe millions of people are going to be dying. So getting that ozone in and really trying to encourage, conversations of science and to get these people to stop, negating ozone because they think it's toxic from from pollution, which is really still where they're at. They don't understand the need that we need to do.
Good. Well, here's something that I've been interested in hearing your opinion, and I'd like to get, again, really, really brief. Maybe if you can give a 10-second answer each on this, if possible. But I want to hear from everybody on this. So there's so many different ways to apply ozone, right? When do you know what to apply? And really the base question, if you just want to answer this one, is it okay to apply ozone rectally and then subcutaneously and then major autohemotherapy the same day? Is there that? Just give a really quick answer if you can, or if you have an opinion.
We're going to
go. So
Margo.
I look at the patient and I intuitively look at the patient too as well. So if I have a dog or cat that has kidney disease, has a heart murmur, I'm not going to use as much ozonated saline as I would if it had. I would use more rectal because I'm not increasing the sodium content in the fluids. So if I have an animal that's really weak and I don't want to overwhelm them, I'll start low and give a small amount. Sometimes I feel like, God, if I don't try, they're going to die. And then if they make it through, that was what I did. And if it was too much, then I shouldn't have gone so quickly. I should have just gone really slowly. So try to play it in between, to figure out if they can tolerate, because they've had ozone before and that they can tolerate it, then give them more ozone. But if it's their first time and you've never seen them before, just go slow and use homeopathics that are gentle and not try to push everything down them in 1 minute.
I'll go next. I don't do them all on the same day because I don't think it's necessary. So if I have a very sick case and that animal can tolerate an intravenous and I have a catheter in anyhow, and the owners can afford doing major autohemotherapy, that might be the first thing I do to kind of set the stage. But we also have the ability in my practice to do lymphatic therapy and to do other forms of detoxification support, which we incorporate in as well. If it's an individual that is not as sick, or the owners don't have the finances, or there's a reason why we can't put a catheter in, then rectal ozone might be our next option. And then the lavaging would be for the case that it's correct for the wound therapies, the cancers that are exterior that you can lavage, the eyes that you want to rinse, the oral cavity.
Great. Someone else.
I think I'm real simple, and I don't know of many animals that you can't treat with rectal ozone. Dogs tolerate it really well. If you're a good animal handler, you can get them to do it. Look, if I can treat my cat who has severe obstructive congestive cardiomyopathy with rectal ozone without killing him, you can get the job done. And so again, rectal ozone is always appropriate. And if you're having trouble doing cats, there are ways to make this happen, but it can be done. And then all of the topical ways can work. I treat every horse with IV ozone. I mean, I absolutely do not have a problem doing that. I do listen to their hearts. I'm very careful about that. I now have, the opportunity to determine whether or not they are a Herxheimer reaction potential animal, but that's something, as Margo says, can be a very intuitive judgment about that. If you know the environment and you read the animal, you can do acupuncture pulses, you can do a lot of stuff to say whether or not these organs of detoxification can take it. But always, just as it says in Schallenberger's work, go low, start slow, but do it.
Yeah.
Well, I'm really concerned about some collateral effects on ozone therapy, so I study this a lot. I would advise for something. Fluids are the most safe because we have the low concentration. And we need to be careful with two things. First, it's anemical animals, special for small animals. For horse, that's not a concern. We have used it in tigers, lizards, birds, every species of animals. We don't have problem if you respect. If the animal is anemic, very severe, because it's an indirect information that his antioxidant system is down. And be concerned about pain, because if you use high concentration, ozone can be painful. And pain can cause a syncope, a shock, right, a neurological shock. So anemia and pain with the concentration. If the animal is anemic, you should use fluids. We have seen that fluids cannot grab a lot of ozone. So we always have low concentration, almost homeopathic concentration, so you can do it with, you can do it very safe.
Well, I agree with everything what was said. It's nothing to be said anyway. We really have to see the general aspect of the case. We really have to match it with each case. We really have to see the health state of that animal. If that animal will bear many ozone administration ways, or just one or just two, or whatever ozone ways we want to practice. So it depends with the case every time.
Great.
Could I make one more comment about what Dr. Joaquim said, very important. Ozonated fluids, you cannot a saturated solution in normal saline will never go above 27 micrograms per milliliter. You can bubble it through there as long as you want. It will saturate at 27 micrograms per milliliter, which is safe level in which to do this. The other thing, like my cat, he can't tolerate a lot of fluids. He does the inside of his heart, is about that big, and he can get a fluid overload very quickly. Ozone's effect is not only the chemical effects that we talk about as, Western scientists, but it has an incredible energetic effect, and a tiny amount of ozone going into the interstitium can reset the whole system. And it is a major piece of signaling information. And it is so important to recognize that, other than inhaling straight ozone and causing a lung reaction and such like that, if you just drip ozonated saline on a wound or on a tumor, or, have an animal drink something or have a ozonated olive oil lozenge, you will get an effect on the whole animal.
Great. Okay. This is a question we had a couple times, and it's one that I've wondered about too, because I've heard on both sides of this issue. What about injecting ozone gas or ozonated saline directly into a tumor?
I do it. I do it all the time.
Yeah.
So I've done several that I've injected sodium bicarb and ozone gas. I will take ozone and flood around a tumor. I'll inject as a saline. I'll do the saline. The one thing that I injecting, when Joaquim mentioned about ozone being painful, one of the bad things that I had was a cat that had fibrosarcoma on a leg that the owners wanted to put it to sleep. And I said, well, let me just try injecting ozone to it. And I injected ozone, and it stung, and the cat just passed out and almost died, I think, from the pain. And the owner said, don't resuscitate. I said, no, I can't, and they said, no, we wanted this cat put to sleep, and you put the cat went to sleep. And I was like, no, so that was a negative thing that happened to me, because I think of the pain piece of it. So, in going into that component about injecting gas, you just got to go a lower amount and go slowly. Don't just push it in really fast, because that was I always tell people what the bad things that happen with ozone, so they can learn the few things that I've learned that are not good. And then the rest of it is so easy to use. So it's just, we can go into one of our negative things about ozone. And that was one of them. And the other that on negative, if your animal is hypothermic and you're using ozonated saline, you cannot warm the fluid up, because you'll lose the ozone that's in there, because when it hits the body temperature, it's released. When you do refrigerate fluids, and that's one of the charts that I showed from Dennis, you can actually get a higher concentration of ozone. So we produce ozone in our practice as an ozonated water and we refrigerate the water before we ozonate it. So we can get a higher percentage of ozone that will take longer for it to break down. So it really depends on your room temperature. If the temperature of the room is cooler, it's going to get a higher concentration of ozone bubbling in it.
There's a paper that shows that the saline effect on tumor is very different from the gas. So if you have skin tumor, you can have different approach with gas and with saline. And if the tumor is not on the surface, so you can inject it for a different effect. So when we talk about different via of ozone, gas, intrarectal, in the blood, in the fluid, they have different effects. So when you think about cancer, you should think about using different techniques.
Not only that, but if you're going to do ozone gas straight, you could also mix it with blood and do your minor autohemotherapy. Yeah. And I'll add a variety of different homeopathics in there as well. Adding viscous in there is a really nice remedy. This is where you just either have to intuitively work with it, or you have to try something, see what the response is. If you don't get a response, then try something different. Typically, it's not one injection, though. Typically, it's going to be
So I've had a few people.
Therapy.
Oh, go
ahead.
I've had a few people, veterinarians, who have come back to me and said that injecting ozone gas directly into a tumor caused the tumor to grow. Any thoughts on that?
No, that's not true.
I think doing fine needle aspirates and not doing ozone will cause a tumor to grow and become infected. So if you're going to do a fine needle aspirate on a tumor, have a syringe of ozone, even 2 cc's or whatever afterwards, so that you're not introducing bacteria into the site and causing it to become inflamed and infected.
I think what happened is people confuse nature evolution of the disease with something you have done. If you have done Reiki, if you just look to the tumor and the other day it grows, it's just because you look at it. It's just about circumstance.
Yeah, more than likely the ozone wasn't inhibitory and it didn't have any effect on the tumor, and the tumor was going to grow anyway.
Absolutely. And the other thing that we oftentimes wonder about when we're treating lymphosarcoma or lymphoma is that when you give ozone and it actually, the body says, oh, I think those are bad cells, I need to go attack it, you're going to have a secondary inflammatory response to start cleaning it up.
Right.
And that actually can look like the tumor is growing. And even if they do an FNA on it, we may not have a lot of necrotic cells very quickly thereafter. So again, you can be accused of causing the tumor to grow. I tend to look at, what does the animal tell me? If I give that dog ozone and it is bright and alert and cheerful and it's eating again and it's pooping and peeing and moving and doing things like that, well, then I'm going to keep doing what I'm doing. And as I say, ozone plays extremely well with conventional chemotherapies if they're properly designed. The major thing is don't kill the animal with standard drug dosages of chemotherapy when the ozone is going to potentiate the effects of them. So if the animal feels terrible after it gets its ozone treatment, it's because it maybe is a little more sensitized to its chemotherapy, and that can be a problem. So that's where you've got to have a good communication system with your oncologist, and you got to have owners that are willing to keep going.
I think
it's a mathematical.
The squamous cell go ahead.
Yeah.
The squamous cell carcinoma case that I presented in the nose was a great example of that. As this dog's immune system got woken up, you could see that not only did the right nostril get worse looking initially, but it actually went into the left nostril before the body got rid of it all.
The answer is a mathematical and statistical answer. We have a lot of guys in Brazil doing ozone and acupuncture in cases of tumors. And what are the percentages that grows and what are the percentages that get small? We just have fewer of them that evolved and grow. So if it was true that ozone acupuncture in tumor patients or in oncology stimulates the growth of the tumor, we would have a lot of cases happen every day and everybody complaining about this. And that's not what happens. It's just like the opposite.
Mm.
Question about protocol for rectal insufflation. So when you do rectal insufflation, we've always encouraged people to try to clear out the colon as much as possible, if possible, prior to actually doing the rectal insufflation. Do any of you guys do an enema? Do you encourage that? Do you put saline in there first or anything like that? Or do you just do rectal insufflation, don't worry about it?
We do try.
I do a lot of rectal insufflations because we do the fecal transplants. So we give rectal, I prefer if they come in with with that colon clean, but we give the rectal ozone and we put their tail underneath underneath of them and have the owners hold it for about 5 minutes, and then we release the tail and we let the dog stay there, and then we'll take them out and defecate. I'd say probably 90% of them defecate. And if I really want them to defecate, I'll do another treatment. I put more gas in there, make them, because I figured that they probably have a lot of feces that, the ozone's not doing as efficient job. And so we'll do another one. And it's not that I feel like I'm overdosing, but if you feel like you have overdosed and you've given more than you need, giving them a little bit of coconut water, a little bit of vitamin C, or a dosage of arsenicum if you think that you gave a little bit more ozone than you wanted to. But I think doing rectal, you can do a lot more and not interfere with anything.
When you pass the catheter, you can feel if you're getting stuck in fecal balls. So if you're able to pass the catheter easily, you inject your ozone and it comes out relatively clean, chances are you had a pretty empty colon. We try to get the owners to walk them and have them have a bowel movement before they come in, but that doesn't always work. And if it is a concern, we do see a lot of animals that are constipated and obstipated. We might go ahead and give them an enema and then make sure that our ozone is getting in.
The other thing that you can do is make ozonated saline and do an ozonated saline enema on an obstipated animal. And what I think is happening is it's reducing the inflammation of the colon from all the pressure that was there. It's another way to use saline, but have another value to it.
Okay. So a question from Nicole here. She said, I read that sodium citrate as anticoagulant for major auto can interfere with cytokine activation. For this reason, heparin is recommended, and especially for allergic or immune patients. Anyone heard anything about that?
I know that Frank Schallenberger prefers heparin when he does this major autohemotherapy. And because I developed a technique called the Geneva technique, because my dog was thrombocytopenic, and I did not want to give her ozone with heparin or any other. So when I do the UVBI on her, and when I did that, and I did it, I don't know, 60 times on her over her life. She lived with malignant mammary adenocarcinoma for 7.5 years and was thrombocytopenic, but the thrombocytopenic reversed with the UVBI. So we started doing the UVBI, and what we would do is I would fill the syringe, a 60 cc syringe. She weighed about 60 pounds, filled it with about 50 cc's of ozonated saline, put a cc of hypertonic ozone, Biocean or Quinton water, and put that in there to add the minerals and the trace minerals. Used a butterfly catheter, pulled the syringe with the butterfly from the dog without taping it in, got my blood, about 5 to 8 cc's of blood in there, mixed it, not allowing it to clot at all, and then running it through the UVBI. Or if you were going to do major autohemotherapy, that you would just not run it through UVBI, but just give it the ozone with the saline without making putting the anticoagulants in. So if I don't know the status of the platelet counts on a dog at that moment, then I typically use the Geneva method because it works, and and sometimes you can get clots in it, and we have special filters that can filter out the clot just in case, because we don't want to give them an intravenous clot. And if it comes like that, then you still can use that sample that you have and just give it sub-Q as a fluid.
Great. So I've had the question about the photobiomodulation. I think Marlene mentioned those early on. What do you use there? And yeah, just real quickly.
For the photobiomodulation, the photosensitizers?
Yeah. So the devices. So what do you use for a device, whether that's maybe a laser or UV or whatever?
The Weber laser is what we use for our intravenous photobiomodulation. It has a special catheter that goes into the 22 gauge catheter that's in the animal. And so the photo beam is literally going through the catheter into the bloodstream. And then we do the photobiomodulation that way, and we give a potentiator beforehand. If we're doing photobiomodulation externally, we use our multi-radiance laser, but that's limited to just 50 hertz. Well, it's a red light laser, and so it doesn't have the green and the yellow, the other frequencies, because they're going to be absorbed by skin and pigment, so they don't have any deep penetration. When we use our Weber laser, we're going directly into the vein. We're not having any inhibition of absorption of wavelength.
So. Right. And with the hemolumen, which Jean Barnett created, that has the different colors as well, the amber, blue, green, and red light. And that is, we're doing UVB in UVA, UVC, and those colors on only a certain part of the blood. He also has some straps that you can put on the surface of the vein that'll go through with the different colors going through on the surface. So, but I've started using that on some of the more complicated cases. But the regular UVA, UVB, UVC works great as well.
Okay, so we've got about 5 minutes left for our question time, and then I'm going to put an offer up for everybody that has stayed to the end here. And we're also going to figure out who's going to win these 3 desktop ozone air purifiers. So there are 3 of them to give away, FYI. So we will get to that in a second as well. In fact, let me do this. Let me post into our chat here the link again, that if you guys share that link that I just put in there, and you're in the United States, and you tell me, you have to actually comment into here that you've done it, and I'm going to trust you, honor system, because it's a little hard to see who hasn't on our Facebook. So yeah, you obviously have to have Facebook as well. I'm sorry. But if you do that, then you'll be entered into that drawing that we're going to do. So just keep that in mind. But a couple minutes here still for questions. So let's get to a few more. Dr. Joaquim, when you do the rectal insufflation, it seemed like you were going quite far into the colon. What are your thoughts on how far you have to insert that?
No, it's just look like that it's far. We just put 10 centimeters of the mango, and with the hands, just the extremity of the hands. It's not so deep. It's very superficial. Okay. And it's superficial for safety reasons. If the horse moves, you just take your hands out very quickly.
And can repeated rectal insufflations dry the colon out? Is there any concern for that or other irritation happening?
No, if you have a colon that's full of feces, he is going to defecate immediately when you start it. So you don't need to go through it, and that would be a danger of hurting the colon or having your arm stuck inside. So there is no any concerns if you do it very superficially. And in general, we put 1.5 to 2 liters of ozone inside of a horse. It doesn't matter the size. It's not going to put more than this. It's not going to fit it more than 2.
Okay.
For our small animals, we will typically do between 1 and 2 milliliters per pound of body weight. And I'll typically do it 4 or 5 days in a row if it's needed, and then take a couple-day break and then continue the following week if it's indicated.
And that was my question. Okay, go ahead.
I also put 3 to 5 mLs of saline in before I do a rectal insufflation, and it increases the absorption dramatically to have the surface of the mucosa. It's quite remarkable how dry it is if the animal does not have wet feces in his colon. So the saline really helps a lot. Like when you use ozone blankets on horses, you want to hose them down first. They'll absorb so much more through the epithelium if you do that. And I've never had one dry out or get irritated.
Great. So the dose for rectal insufflation in horses would be, what is the concentration you're using again, Dr. Joaquim?
I started with 15 and I go just until 25. I don't go further.
15 micrograms per milliliter and about 1 to 2 liters.
Yes.
Okay, great. Okay, let's see. We are out of time for questions, I think, at this point now. If you do have questions, guys, these doctors, they have nothing to do. None of them. So they're just going to be sitting around waiting for your questions. No, okay, so I lied. I'm sure everybody's busy with certain things, but we can continue with that as we move forward, just asking questions.
But I really want all of you out there to understand that this tool may be something that is maybe not the perfect magic bullet, but it is something that we have to be communicating with our colleagues in medicine to understand that this could be something so valuable. And that's where this website that Karen Gelman is putting together with all the stuff is going to give give them the peer review research articles so they can make that decision themselves and see that we could help these people that are dying in nursing homes and hospitals. And, you know, we have some kind of tool, and it has to be given the respect that it needs so that we can make a difference.
Jonathan, if I may, there's one thing that no one brought up in any of the lectures and nobody asked the question, but I believe in working within the biology of the body. And I think when we can do that, we get the magic. And there is a molecule called NRF2, and ozone is known for turning on NRF2, which is a huge molecule for turning on over 200 anti-inflammatory pathways. It aids in detoxification. It's a major part of detoxification. So, you know, from a biochemical standpoint, ozone is a direct player in detoxification and the antioxidant system by being able to turn on these pathways.
Great. Okay, so here's what we're going to do. I posted, there's a few products. We have suppositories that are a cool new thing for ozone. Suppositories and some skin products for pets. We have pet liniment, and I don't think you can see it very well there in the screen, but in hydrogel. These are for skin and for mouth related conditions. So we have just a little kind of promo that I put up there for people who are interested in those products. They're great for people who maybe haven't even started, but they want to try an ozone product. So if you're interested in that, go ahead and take advantage of that.
Thank you, Jonathan.
Thank you.
Thank you.
Thank you, everybody. Bye.
Everybody stay safe, wash your hands, and drink those.